Let's talk about compression garments. So compression garments are a little like religion in plastic surgery. Unfortunately, there's a whole lot of opinions and not a lot of great data. So compression garments are just medical girdles, and we use them in plastic surgery for a few reasons. So the first reason is we want to compress the area that we worked on in surgery and minimize swelling. The next reason is that we want the area we worked on to be flat and smooth, and we don't want it to hang or be irregular. And so having a nice tight compression garment will help with that. So the last reason that we usually use these things is to prevent seromas from forming. So seromas are fluid collections, and anytime you have a raw surface area or you've removed tissue, like with liposuction, when your body wants to fill that empty space with fluid, you have the potential to have a fluid collection. And your body sometimes can't absorb fluid collections over a certain size. And those collections can look funny, they can be painful, and then they can also get infected. So these garments can help us prevent that. So faja is typically the terminology that you'll hear out of South America, and it's just their version of a compression garment. So when it comes to how long you wear the garment, there's really no perfect answer. So it's really going to depend on what exact surgery you had and what your doctor's experience is. And you always want to go with what your doctor recommends. So pretty much everyone will have you wear it at all times for at least 2 weeks. And then after that 2 weeks is where you'll see everything under the sun. Some surgeons will tell you to take it off at night and wear it during the day for a few weeks. Some surgeons say at all times for 4 to 6 weeks. And I've seen some surgeons recommend for 3 to 6 months at all times. So in general, in my practice, I have patients wear them at all times for about a month after surgery. And we can alter that depending on how they're tolerating it, how they're healing, and then also if they have any potential complications. So people that have prolonged swelling or they've had a seroma and some kind of issue, I might have them wear it a bit longer. I'm not a fan of wearing it for a very long period of time. I've seen a handful of patients that have done that, and they've developed pretty significant core weakness. And I don't know for sure it was from the garment wear, but I don't necessarily love that. I think it's really important once you have any type of plastic surgery that you get back to your normal exercise, and core strength is so important, especially as we age. I want all my patients to have a really strong core. So in general, like I said, it's not a really satisfying answer. It's just, different surgeons recommend different things, and you always want to do what your particular surgeon recommends and what works in their hands. So let me know if you have any more questions about fajas or compression garments.